And this is a question I had been asked a couple of times and even saw on Facebook yesterday. I wanted to ask this to the staffs. I know there's basically no visitors allowed in these COVID floors and these COVID units. It's a tough decision both hospitals had to make, obviously, especially if you have family or friends up there. But what avenues are each hospital taking? I know MCH, Kristen, you want to talk about iPads. I'm sure ORMC is doing something similar.
Sure, absolutely. So there's two different ways that we're communicating at Medical Center. If they're an end of life, we are allowing those visitors to come in 2 at a time for those patients. If the patient is positive COVID, we're utilizing our FaceTimes and the iPads that we have in the unit so that those family members can converse with those patients if they're able. And then we also are, as we spoke yesterday, talking, our nurse leaders round every day on every patient. They ask the patients if they would like us to contact a family member so that we can update them on their care, and we let it up to the patient decide whether they want us to call or not. And we're making those efforts and phone calls every day.
Almost exactly the same for ORMC. For end-of-life cases on a case-by-case basis, we're allowing 1 visitor at a time. But other than that, everything else is exactly what Kristen described is what we're doing here as well.
Okay. And another question that just came in, I think we know the answer. If a patient goes into the ER for something other than COVID, will they be able to have a family member with them at all times? Kristen, I know at MCH, only if they meet certain criteria, correct?
That's correct. We're using our Medical Center general visitation guidelines in the ER as well, because we want to limit the number of people exposed in our our ER waiting rooms. So if you are a non-communicative, if you are a parent of a pediatric or you're end of life coming into the ER, then we will allow you to have that visitor. Otherwise, we are not allowing visitors into the emergency room at this time.
Okay, Trevor, a small difference for us. We're not as strict at our end. Perhaps we should be, but we are allowing 1 visitor for all the ER patients right now.
And then one other question for Dr. Saravan and even Dr. Davenport and Kristen. You guys have seen the COVID floors and been around the staff. What is the morale of the staffs like that are dealing with these COVID patients, these possible PIs every single day? Dr. Davenport, what have you seen so far from the staff?
I've talked to a fair number from the CCU floor, more so than the 7 Central floor, and everybody seems to be relatively upbeat. With regards to certainly the death that we had took a toll on everybody with regards to that being our first and trying to gain an understanding of what we can do to try and improve care from that, learning from that. But overall, I think the number of cases that we've had have not been a substantial management problem for the nursing staff and the physician staff, which has been really good and has allowed them to appropriately take care of the patients from that standpoint. So overall, I think morale's pretty darn good, as well as the rest of the hospital. They understand what our policies and procedures are with regards to taking care of patients in general, those that are potentially under investigation, and the general population as well.
So at ORMC, Trevor, I talk to them every day, or I try to visit them as much as possible, at least once a day. I think the best description is if you watch the video from us releasing that patient yesterday night at 7 o'clock, I think that will tell you what the morale is of the people working in those floors. I think it's always mixed emotions. They're working hard. They're in PPE for long hours. They get less breaks than other people, but they know they're doing important work, and they know that their work is meaningful, and that's what brings them every day and allows them to help these patients. And then those victories that we win by getting these patients better and discharging them, that keeps them going. So that's the morale is great so far.
Kristen, you wanted to add something too?
I was just going to say that I do agree. And Dr. Saravan's right. Some of these, you're finding that they are really stepping out of their comfort zones. We're used to taking care of patients that are ill and wearing PPE, but this is just a little bit more of a stressful situation. The nurses, every time I'm around they're smiling, they're upbeat. In fact, the other day I walked through critical care and they had some low music playing. They're trying to make the most out of the situations. They're excited when the patients get to go to a lower level floor with their care, but also see creative and how can we put our PPE on and off safe but better and quicker and more efficient, and how can I help my buddy? So they're starting to think out of the box in terms of all kinds of things, and so it's giving them a sense of accomplishment, I think, as well, because they're being able to do things that they might not have either been able to do or think of doing when caring for non-COVIDs. They're starting to get a routine, so it makes things a lot easier for them because now it's not something brand new to them. They do it every day. So I think that they are all just taking it in stride, and I couldn't be prouder of the staff at Medical Center and all of the things from nursing staff, RT, even to housekeeping. They've all adjusted their lives, and they're doing so well.
Thank you, Kristen. All right, we're at 3:27. We have any more questions? If not, we can go ahead and reconvene tomorrow at 3.
Trevor, I had one more.
Okay.
Our corporate graphics folks kind of put stuff in context today, quoting the CDC saying 24,000 people are estimated to die during this influenza season. The CNN saying now 27,000 have died from COVID over the last 5 or 6 weeks. And I wanted to ask the doctors and Kristen and Stacy and Russell, does that put that in context for the people who thought this isn't as big as the flu or this is the same as the flu?
I can start to take a crack at that if you don't mind, Scott. So we can put that number in context, but don't forget to add the amount of social distancing we have done and how the country has been literally shut down by COVID. So we can't remove that out of context either. I think the 27,000 number that you said for COVID is despite all the measures we have taken so far. So it's not a real comparable number to the flu because flu is a yearly thing that happens every year, and that's how many people die from the flu, unfortunately. But for COVID, you can see with all the measures we've taken, we've still lost that many. And that's why it's as serious as we make it out to be. And that's why all these social distancing things are as important. That's why it shut down our country as much as it did. I don't know if that answered your question.
Dr. Davenport, you have anything to add to that?
No, I would agree with that. And again, I think that, and this is always going to be a sore spot, whether we talk about it or not, the amount of testing that we do and the limitations that we have across the board. If we had the capability of testing more people, we may find that more people have it than what we expect them to have. And so that'll drive our numbers up substantially as well. But again, probably as important as that is the recognition that of those that test positive, a majority of those, at least in this area, are being able to be isolated and quarantined at home and treated without hospitalization. And that's extremely important when we're talking about utilization of resources and getting the community back together. And so let's continue to do what we need to do under appropriate guidance, certainly from the governor, and make this continue to work. We know it's going to be a long process. This is not going to go away in a month. It's not going to go away in 2 months. We expect this virus to be around for a while. And so it is going to change some of our processes and what we do, hopefully for the better, but we're going to have to recognize that we're in this for a long term.
All right. Scott, you have anything else?
No, sir, I'm good. Thank you.
All right. Well, thank
Trevor,
you.
I did have a couple of public service announcements, if you don't mind.
Okay.
So one of the things that we've kept mentioning are these 3 words, social distancing, quarantine, and isolation. Right. So I wanted to make sure we understood at least how the CDC interprets these words. Right. Social distancing is the 6 feet distance, not gathering in groups, and avoiding crowded places. Quarantine, it means someone who might have been exposed to COVID. So social distancing is for everybody. Quarantining is for people who might have been exposed, and they're basically told, self-quarantine, stay separated, limit your movement to the outside. Isolation is to separate sick people from healthy people. So that's what we do, like in a hospital, for example, you put a patient in an isolation room versus a regular room. So that's the difference between social distance, quarantine, and pure isolation itself. Next, I wanted to show this, which was a question from yesterday. And this was about how to clean and disinfect your house. There is specific guidance from the CDC on how to mix bleach solution, for example, 4 teaspoons in a quart of water, which surfaces to clean, the high-touch surfaces that we've kept mentioning, what kind of products to use. Most household disinfecting wipes would work, what to do with soft surfaces, what to do with electronics, and how to do your laundry. So this is guidance that the CDC also provides. I will share that document with you guys. And the last thing I had was this. And we've talked about the fact that most of us are very worried about the new coronavirus, but we can't ignore other things that could also happen, especially if you have a heart condition. So if you have chest pain, difficulty breathing, or discomfort in your neck, your arms, your shoulder, your jaw, those could be signs of a heart attack. You should be calling 911 for those. If you have numbness or weakness or loss of movement on one side of the body, like your one arm or your one leg, if you have confusion, trouble speaking, or loss of balance, those could be signs of a stroke. Those should also result in a 911 call. So just because we're in the midst of COVID and we talk about all of these social distancing, we should not ignore the fact that there are still other medical conditions we need to watch out for. That's all I had.
Thank you, Dr. Saravanan. And we looks like we are done, and we will see everybody again tomorrow at 3 o'clock. Thank you, guys.